everyone. I'm your host, Carla Macias of the Best Docs Network featuring Forest Park Medical Center, San Antonio. From their staff to their surgeons to their technology and technique, Forest Park Medical Center is your destination to better health. We're going to start today's show by introducing hand specialist Dr. Jackson Mbamba.
Everything happened kind of at once with both hands. I lost control of my pinky and ring fingers, and then I couldn't hold things. I couldn't hold a coffee cup or pick up things. I was having a hard time writing, and it all progressed very quickly. I went to see 2 or 3 different doctors, not knowing what was going on, and had MRIs and CAT scans, and everything just turned up nothing.
When she came to see me, I examined her. I found out that she had what is called carpal tunnel syndrome. Carpal tunnel syndrome is when the ulnar nerve is compressed at the elbow. The symptoms people feel when they have carpal tunnel is the hand completely fall asleep. They've got pain in the elbow. They've got tingling in the fingers. They've got numbness in the fingers. They don't feel that they have enough strength to do their activities.
Dr. Mbamba recommended that we do surgery pretty quickly because the condition had evolved very fast and it was worsening very fast.
I took her to surgery and I proceeded to do endoscopic carpal tunnel release. Within a short time, in a period of 10 days, she was almost pain-free. The tingling and numbness she was having in the small finger and the ring finger went away. The pain she used to have in the elbow took some time to go away, but within a month, the pain has completely gone away and she was back to our daily activities.
I had the procedure just right about 2 years ago, and I don't even think about it anymore. I can't tell you really how much this procedure changed my life. What I was looking at was having to learn to be left-handed. I couldn't pick up a coffee cup. I couldn't write well. It was worsening every day. And my life is back on track. I'm able to do anything I want. I don't have any limitations. And that's so much to be thankful for.
that's what they will remember. It's the Disney of healthcare.
Forest Park Medical Center is a different kind of hospital, designed for Warren, designed for comfort. Forest Park Medical Center is your destination to better health. John has a question for Dr. Jose Barrera. Can surgery improve my snoring and sleep apnea?
That's a great question. Snoring can improve with surgery, and so can sleep apnea. One of the things we do is we sit down with the patient and evaluate the patient and find out whether snoring is secondary to nasal obstruction, so secondary to sinus problems or structural problem within the nose. So by addressing the nose, snoring can be improved. In addition, patients have a very floppy, soft palate, and so by reorienting the soft palate, maybe providing a small lift to the soft palate, we can resolve 90% of snoring. Sleep apnea can also be improved with surgery, which involves treating both the nasal airway, the tongue, as well as the palate. And so it depends on whether patients have obstruction at these sites or a combination of sites, and we target those in sleep surgery.
My position at Forest Park is the Director of Staff Development. I am in charge of the education program throughout the facility. The employees not only learn the first day that they are employed at Forest Park, but it's a continuous process. What I am excited about is the physician involvement in the education process here at Forest Park. The physicians are very engaged in making sure that staff involvement in the education process is continuous. They're invited to come into the operating room if they are a nurse in another area, so they have a better understanding on how to take care of that patient, especially controlling their pain while they are recovering at our facility. We are going for our AOA accreditation here at Forest Park, just as our other sister facilities are. And so there are lots of standards to raise the bar on patient safety and patient care. On a daily basis, we are striving to make sure we exceed those standards by making sure that our staff feel that they have the tools they need to succeed and take care of their patient. Learning every day is why we're here, and it makes Forest Park an exceptional place to work.
One of the features over at Forest Park Medical Center is that their OR rooms are larger than average hospital operating rooms. One of the surgeons that will be performing surgeries in the OR rooms is Dr. Francisco Rodriguez. Let's take a look.
The issue that I had was that I couldn't eat or drink anything. And I had a lot of acid indigestion. My stomach was very swollen up, and I couldn't sleep at night.
We went to the hospital and they said that she had colitis, and they ran tests on her and they decided that they needed to cut out some of her colon. She didn't want to do that. We went for a second opinion. One of the doctors called me outside and told me she was very sick and she was very fragile and it was best just to leave her alone.
I didn't have any strength anymore. I was on IVs all the time. I couldn't think right. At that point, I said, no, just let me go.
Her family doctor, he's the one that recommended for her to see Dr. Francisco Rodriguez. He was very confident with the procedure that he was willing to do. He was trying to go a route that was not some serious operation. The procedure that my mom and I decided to go with was the vascular bypass.
Carmen came in with a long time history of pain in her stomach. She'd had what was found to be lack of blood flow to her large intestine. She'd been in and out of the hospital, had anemia from all this, and when we found out what the problem was, she had vascular disease, which is blockage of the blood flow to her intestines. Normally, you would have had to been opened to have a bypass to the artery. Luckily, in her case, we were able to fix it with a stent. Minimally invasive, you may be in the hospital for 24 to 48 hours. If you have it done open, you're usually in the hospital 5 to 6 days, and you have a lot longer time of recovery and pain. In an older population, it's a lot nicer to do the minimally invasive because they don't recover as easily.
It was good. In other words, right away I started eating. I was in bed rest maybe 2 or 3 days. After a week I was cooking. Everything was fine, you know, and I felt great.
Francisco Rodriguez is truly our guardian angel. Because of him, he gave my mom and my family more time so that we could spend with her and enjoy her longer.
Eating eggs for breakfast not only tastes good, but they help to slim you down too. Each egg you eat has 6 grams of protein, but only 72 calories.
It's a very exciting day, obviously, this partnership, because obviously Forest Park Medical Center believes in excellence. We pride ourselves on world-class service, and what better world-class organization is there than the Dallas Cowboys?
The cultures are so aligned. It's 2 groups, people, 2 teams that are really focused on excellence, have a passion for excellence. And it takes the same sort of things to make it work, because it's a team effort in the hospitals as well as on the field. You need the coaches, you need the players, the trainers, you need all the equipment staff here and in the hospital, the nurses and the physicians, the technicians, all the people who maintain facilities all have to work together.
And really, if you think about what we do in healthcare, surgeries and the complexity of putting together a team, we honestly play the Super Bowl every single day, every patient. Our surgeons are quarterbacks, and they've got a team of great associates. Everybody's got to be the best and brightest at what they do, and together they can finish a game and score a big win for a patient. It's very much like football.
Our goal for Forest Park Fort Worth is really focused on excellence and innovation, and that's what the Cowboys are about. They have a strong tradition of really excelling at what they do, and that's what Forest Park does. And we think that is going to be really significant to the community and to their surrounding communities. And we think that not only will Cowboys fans love the Cowboys this year, they're going to love Forest Park.
And if you look at the Cowboys, it's excellence year after year. It's an awesome partnership. The excellence of the Cowboys and the outstanding patient care and customer service at Forest Park Medical Center, you couldn't ask for a better team.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center.
Dry cough is a very common problem that affects a lot of people, and sometimes it even interferes with their sleep, and it may lead to urine incontinence. A cough is not a disease, but it's a symptom of an ongoing disease. Things that can cause a dry cough are reflux, postnasal drip either from allergies or from chronic sinus infections, bronchitis, asthma, and sometimes even medications. For example, when you're taking ACE inhibitors, which are medicines for blood pressure, like enalapril and lisinopril, you might have a cough from these. So discontinuing these medications will usually resolve the cough within the next 2 weeks. Allergies are one of the most common conditions that will lead to cough, and patients usually experience postnasal drip. Sometimes they'll also notice itchy eyes or itchy throat. Treating it with an antihistamine and with anti-inflammatories like nasal steroids will help to reduce the cough. In other patients, the cause of the cough could be what we call silent reflux or LPR. As opposed to patients that have the common reflux, what these patients experience is no heartburn at all, but they may have this chronic dry cough. This is usually treated with medications that reduce the acid. Cough can also be a sign of a serious illness. For example, chronic bronchitis, pulmonary emphysema. It could also be lung cancer. So make sure that you talk to your doctor if you've had a cough that's lasted more than 3 months.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients. And working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just very much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
Finding the right doctor for you is just a click away. Just by going over to bestdocsnetwork.com, clicking on the Our Doctors tab, and scrolling to San Antonio. Here you can find all the doctor's profile, read their bio, check out their video gallery, and also request an appointment. One of these doctors that you can find is San Antonio family physician Dr. Solomon Paley.
I had problems with kidneys before, and I had past kidney stones. And when I was going through my pain and all that, I thought that's all it was. And it got worse and worse. I started getting a fever, then I started throwing up, and that's when I knew it was more than a kidney stone. My previous episodes with the kidney stones, I had not experienced that. As it turned out, when I saw Dr. Paley, he looked at me and said, "You're going to the hospital."
This patient had been established with me for quite a while. He came in for a visit one day, and he was quite ill. He had evidence of kidney failure, and his blood pressure was dropping. We put Raul in the hospital and obtained the appropriate consultations, and he was indeed in renal failure. He was very close to death. The specialist didn't give him a good chance of making it through. We did everything we could aggressively, and fortunately enough, he turned around and he's living a very active life today.
I feel great. I was not given a very good chance when I first walked in there when Dr. Paley saw me, but I made it through. My daughter was going to be getting married, and I just fought like heck to make it, to survive. I got better, and I made it, and I'm here today.
Kidney disease, including renal failure, is seen in patients who have uncontrolled hypertension, uncontrolled diabetes, uncontrolled cholesterol, and over a long period of time, these take their toll on the kidney, and slowly but surely you see the kidneys start to fail, and we're able to detect that through lab tests. In early renal failure, the patient won't feel any difference. That's why it's important for the patient to come in for routine examination and lab testing so that we can screen for things like renal failure, catch them early, treat them, and have patients have a nice turnaround.
From the time I do remember, the 14th, 15th day, Dr. Paley was there daily. And I appreciate that a lot, because he would go see me no matter what he was doing. Dr. Paley's guidance, I managed to change my lifestyle, change my eating habits, change what I do. So now my quality of life is 10 times better.
One great thing about Forest Park is that they include the dining aspect or the food aspect as far as the patient care. Not only do they have great dietitians on site to make sure that the dietary needs are met for the patients, but they also consider the patient's family's needs as well. Let's face it, sometimes you're in a hospital, this facility, 6-7 hours, if not longer, sometimes overnight, sometimes 2 or 3 days. And it's not the typical food. We do everything from scratch, which means that we do everything from the starting point all the way to the finished product. We do pork tenderloin, we do roasted chickens, we do gourmet pizzas. We even do some things similar like grandma's meatloaf, but everything's made from scratch. We follow recipes, nothing comes out of a can. Our sauces are all made from scratch. When you walk into our dining facility here name is Cafe 114. It feels like a real cafe. You don't walk into it and it's the old type of tray line service here. Every single day the menu changes. So for example, one day you may have a carving station with a prime rib on it, and the next day on that carving station may be a baked potato bar, and the plate itself is a work of art. It's just not something that's piled on the plate and sent to the guest or sent to the patient. It's a work of art because, you may not always come in here where you just on a clear liquid diet. You can actually have surgery where you can eat regular food. So we have to take those cases and we want them to feel like, you know what, this is unbelievable. This is not hospital food. We don't ever want to be stereotyped or categorized as hospital food. We are a cafe dining facility. You can get fresh grilled salmon, we have fresh tuna here, we have a fish of the week, we have grilled pork chops you can get, grilled chicken. Along with that, you can have that grilled, make your salad, give it to one of my grill cooks, and we'll put it on the salad for you. It really starts with Chef Jason Douglas. This guy is absolutely amazing when it comes to food. He is truly an artist when it comes to the culinary aspect of it. He has an eye for making your food look so pretty and edible at the same time that you don't want to touch it because it looks so great. That's one element about dining service I don't have to worry about because I know when he's there that the guests, our patients, are going to get the absolute best that he has to offer every single day. So what we try to do is we try to be innovative with our food, very cost effective, but most importantly, we want a great quality of food. I have this saying that if it's not done in the spirit of excellence, we won't serve it.
As we see it, advances in medicine have as much to do with patient comfort as with medical technology. Oh, at Forest Park Medical Center, we invest in medical technology as much as any hospital in North Texas. It's just that we invest in other things as well. You see, Forest Park Medical Center was designed for warmth, designed for comfort, designed for, dare we say it, our patients. Come see for yourself what medical care should be. Forest Park Medical Center, your destination to better health.
One of the great things about the doctors over at Forest Park Medical Center is not only are they getting involved in the medical facilities, but also in their communities, whether it's locally or around the world. Up next, we're going to introduce Dr. Kathy Grove and her trip to Honduras.
The church that we happen to go to has a relationship with a girls' orphanage in a small town in Honduras. The orphanage is run under an American lady. The name of the project is called Project Talitha Kumi. And it's basically a girls' home where they house 30 girls who were either abandoned or abused or orphaned. They were having some problems getting vaccinations for the girls in the girls' home. And so we received a phone call asking us to come down and assist in vaccinating the girls at the girls' home. We had to go through a lot of different and interesting challenges in order to be able to go down there. First of all, we had to get permission to practice medicine in a place that had never had an outside doctor come to it. We were able to overcome that challenge, and then the next challenge was actually receiving the immunizations that we could provide to the children. We asked several different pharmaceutical companies. We requested assistance from many of the hospitals that we work with, and we came up initially empty. We then came to Forest Park and asked them if they would be able to help us get the vaccinations to take to this small girls' home in Honduras. And thankfully, Forest Park came through. They gave us, free of charge, the vaccinations to cover every one of the girls that lived in the girls' home. The older teenage girls from the home actually came to the clinic and helped work they functioned as medical assistants for us as well as translators. And so they were helping clean the rooms, they were helping prepare the vaccines. It was really a great experience to watch the local people work to serve their neighbors. And because they were working in our clinic, they weren't able to do their daily chores. After the clinic, we actually went back to the girls' home and helped them perform their chores afterwards. We ate their meals with them. We said nightly prayers with them. It was an amazing experience. As a surgeon, I think we have an incredible opportunity to meet and care for people at a time of great need. For me, my whole purpose in life, my dream job, is being a surgeon. I love nothing more than being able to walk through these difficult journeys with people and help them find the happiness on the other side. And so one of the things that I love most is being able to take these little short-term trips to patients and people who have great need, because it's the whole reason why I became a surgeon, and it helps remind me how much I love this job and how much I love the people that come to me.
The PRMA Group specializes in breast reconstruction surgery as well as many other plastic surgery procedures. Dr. Gary Arishta is a plastic surgeon here in the San Antonio area. Now let's meet the doctor.
I was in the military for 25 years and did a lot of breast reconstruction in the military. I got into plastic surgery a little bit by chance. I was doing a plastic surgery rotation in medical school. We did a breast reconstruction on a woman. We went in to see her and she was just sobbing. What she said was that her husband hadn't seen her undressed ever since she had her mastectomy. She was so happy that she could turn on the lights now. It sounds corny, but it was such a profound moment for me. I kind of decided then that that's what I wanted to do. When I retired from the military, I was able to join this wonderful practice and really specialize in breast reconstruction.
Start sprinkling your oatmeal with some cinnamon. Studies show that this antioxidant-rich spice may reduce blood pressure and lower stress. Thank you so much, everyone, for joining us on another episode of the Best Docs Network featuring Forest Park Medical Center right here in San Antonio. If you're still curious about any of the doctors you see on today's show, head to our website, bestdocsnetwork.com. Got any questions or comments? Feel free to email us at info@bestdocsnetwork.com. So long, everybody, and we will see you next week.